Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. In this presentation, we're going to discuss hand washing. Hand washing is important because it removes microbes, which are tiny living organisms that may or may not cause disease, and it removes germs, which are types of microbes that can cause disease. Hand washing is the most effective means of preventing the spread of germs and infectious diseases such as the common cold, influenza, ear infections, strep throat, diarrhea, and other intestinal infections. Hand washing stops germs spread from people frequently touching their face, from hands transferring the germs to food, and from hands transferring germs to other objects. Hand washing also can prevent a large percentage of foodborne disease outbreaks. Not washing your hands can harm children, as younger children are at a greater risk of respiratory and gastrointestinal diseases, especially if they are cared for outside of the home. About 1.8 million children less than the age of 5 die annually from diarrheal diseases and pneumonia. Soap hand washing may protect 1 out of 3 children with diarrhea and 1 out of 5 children with respiratory infections. Hand washing also helps to battle antibiotic resistance. It prevents about 30% of diarrhea-related illnesses, prevents about 20% of respiratory infections, and it leads to decreased antibiotic use, which will decrease the resistance to antibiotics. It can also prevent illness from germs that are already resistant to antibiotics. Germs can get onto your hands from human or animal feces, also known as the fecal-oral route. It may be visible or invisible on hands. 1 single gram of human feces is about the weight of a paperclip and may contain 1 trillion germs. Germs can also get onto your hands from sneezing, coughing, and rubbing your eyes. Hand washing education is everyone's responsibility: parents, children, caregivers, healthcare personnel, and food handlers. Community education can decrease diarrhea illness by 31%, and decrease diarrhea illness in immunocompromised people by 58%, and it can decrease respiratory illness from 16 to 21%. Diseases can be spread from handling food or animals, shaking hands, using the toilet, or touching shared objects such as doorknobs, elevator buttons, grocery carts, telephones, and computer keyboards. You should wash your hands before touching your eyes, nose, mouth, or ears, and before inserting or removing contact lenses. You should wash your hands before and after preparing food, especially raw food, eating food, giving medicine, caring for someone with an illness, and treating a wound. You should also wash your hands after using the toilet, changing diapers or helping someone else use the toilet, blowing your nose, coughing or sneezing, handling soiled utensils and equipment, handling money, handling animals, animal toys, leashes, or animal waste, especially from reptiles or livestock, handling pet food or treats, handling garbage or household and garden chemicals, handling contaminated items such as cleaning cloths or soiled shoes, and after shaking hands. You should also wash your hands whenever they look dirty. When washing your hands, remember to wet, lather, scrub, rinse, and dry. You can visit the link on the right to see a demonstration video of how to wash your hands. Wet your hands in clean running water. Your hands may be recontaminated if you wet them in a standing water basin that has previously been used. If there is no running water, however, use what is available. The water temperature does not affect the microbe removal. After wetting your hands, turn off the faucet to save water. Be sure to apply soap, as this is more effective than just water. The soap lifts the soil and removes the microbes from the skin. And people scrub their hands more thoroughly when soap is used. Be sure to lather your hands. Rub them together with the soap, including the backs of hands, between fingers, under nails, the palms, and the wrists. This creates friction, which lifts the dirt, grease, and microbes. There are microbes on all surfaces of your hand, and there is a high concentration of the microbes under your nails. Be sure to scrub your hands for at least 20 seconds. You may hum or sing the happy birthday song twice. The optimal time to scrub your hands is dependent upon the type and amount of soil and the setting of the person that is washing their hands. Evidence suggests that hand washing for 15 to 30 seconds removes more germs than a shorter period. Rinse your hands well under clean, running water to rinse the microbes off the hands. Also, rinsing the soap away minimizes skin irritation. If you rinse your hands in standing water, they may become recontaminated. There are some recommendations to use a paper towel to turn off the faucet. However, there are no studies showing that this improves health, and it leads to an increased use of water and paper towels. Dry your hands using a clean towel or air dryer. Germs are transferred more easily to and from wet hands. Some studies show that antibacterial soap is no more effective at killing germs than regular soap. Also, antibacterial soap may lead to resistant bacteria. Antibacterial soap is suggested in the medical setting, but not in residential homes. Hand sanitizers may be used if soap and water is unavailable. It is recommended to use hand sanitizer with a concentration of at least 60% alcohol, as it is more effective than lower alcohol concentrations or non-alcohol-based sanitizers. Non-alcohol-based sanitizers may not work well for all germ classes, and it can cause resistance development to sanitizer. It may only reduce the germ growth instead of killing the germs, and it can be more likely to irritate the skin. Hand sanitizers quickly reduce the number of microbes, but does not kill all germs. You may not use enough sanitizer, or you may wipe it off before it's dried. Soap and water is more effective for some germs. Hand sanitizer is not effective for visible dirt and grease. Soap and water is recommended in circumstances such as after handling food, playing sports, working in the garden, and camping or fishing. Hand sanitizers may not remove harmful chemicals. One study showed that there was actually increased levels of pesticides after using a hand sanitizer to clean the chemicals off your hands. Be sure to use soap and water or as directed by poison control. Swallowing hand sanitizer may cause alcohol poisoning. Older adolescents and adults may purposefully swallow hand sanitizer in order to become drunk. Young children are more likely to swallow scented, brightly colored, or attractively packaged hand sanitizer. Between 2011 to 2015, there were about 85,000 calls to the United States Poison Control in relation to the consumption of hand sanitizer. Always be sure to supervise young children around hand sanitizer, and you may use child-resistant caps. Always be sure to read the product label when applying hand sanitizer. You should apply enough hand sanitizer to the palm of one hand to wet your hands completely. Rub your hands together over all surfaces until your hands are dry. This concludes the hand washing presentation. If you have any questions, please contact your local health department or visit one of the websites listed here. Thank you.